Hi, everybody. These streets surrounding the United Nations are bustling. You see cop cars, you see tons of black SUVs. What I'm not seeing, however, are masks, hardly any at all. And Kate Dodson is here with me now. She's the VP of Global Health Strategy from UN Foundation. It was the topic for the last 2.5 years of work at the UN. It's barely a mention, at least seems to me this time around. Where are we at in the global fight against COVID?
Well, the WHO Director General, the World Health Organization Director General, declared an end to the acute phase of the pandemic in the spring, recognizing that case counts were down, the level of access to countermeasures like vaccines and therapeutics was high, and the world can't live in a perpetual state of kind of pandemic lockdown, right? So COVID right now is being managed as a high priority infectious disease, but trying not to kind of inhibit people, the flow of the economy, the flow of people. We're obviously in a more specific wave right now with infections on the rise. So people who have comorbidities are, often masking, but the general population doesn't feel like they have to anymore.
Let's hope that this UN General Assembly doesn't become a super spreader event.
Let's hope.
Yes, we're hoping. But so I want to take a step back. We're going to talk a little bit about the broader global health scope right now. But I don't want to assume that everybody knows what the UN Foundation necessarily is and does and how it's separate from the UN. If you could just sort of briefly explain that for people.
Yeah, we are a 25-year-old public charity that was established as a means of connecting people, ideas, and resources to the UN. So we exist to build coalition, to inspire actors to work better and with the UN and to help the UN be a better service to the world's people.
On a myriad of issues.
That's right.
That sort of mirror a bit the Sustainable Development Goals, yes. One of which, of course, being better global health systems, which is where you come in.
That's right.
So if you were a doctor, you might be, are you? No.
I'm not.
Okay, you're not, but you're playing one on TV. No, just kidding. But if you were a doctor, what condition would you say that global health is in right now?
So global health right now is not dissimilar from where we are on the overall Sustainable Development Goals, which is to say not doing great, but have the chance to improve. We're about 15% of the Sustainable Development Goals are on target to be met by 2030. That's not great for where we are at halftime. But we've got levers to change that, and I think this week is about how to make that change. And we're going to see that a lot in global health issues this week.
Let's get specific for just a second. So when you say we're just not where we're at, where are the vulnerable spots?
Yeah.
Are we seeing, for example, upticks in illnesses or viruses, malaria, for example, right? That we're doing a little better before COVID. I just want to give people a real sense of what's happened.
Absolutely.
Yeah.
The world in the last two decades has made really remarkable progress, especially against infectious disease and improving child health outcomes. And that's primarily because of the deep investment in HIV prevention and treatment, and malaria prevention and treatment, and immunization. And those gains, though, were stalled or in some cases eroded during the pandemic. We had a 30-year backslide in immunization rates over just the past 3 years. Now, less than around 80% of children are getting access to life-saving immunization in the last year. That's a real problem because we have gains to remake that were hard fought over the past couple of decades. Generally, though, half the world's people lack access to essential health services. That is a remarkably shocking statistic. And 2 billion people each year are pushed into poverty or further into poverty because of trying to pay for healthcare services. And that's the crux of what the UN's talking about this week when it comes to health issues, is how to change the tide on that.
It seems to me another alarming trend is that governments are, many of them, certainly in the developing economies, are getting deeper and deeper and deeper into debt, which means they're spending less and less money on health and in education and other sort of basic services. You say we have a number of levers that we can pull. What are those?
Yeah. Well, some of them do relate to financing, and there's conversations happening this week on that. How do we use both domestic financing that countries are putting into their health systems more efficiently, more effectively, and more radically reoriented towards primary care? You can deliver 95% of essential health services through primary care. So how do we enable kind of policy action for member states around the world to invest in primary care, for instance? Then there's the question of how do you add new resources into the pot? And that's a really difficult question that is not just related to health issues. We are blessed in the global health community with robust institutions like the Global Fund to Fight AIDS, TB, and Malaria, like Gavi, the Vaccine Alliance, that help pool procurement, pool resources on a global scale to get people access to vaccines and medicines in low-income countries. So how can we make sure that tools like those are best and better leveraged to provide the supplemental resources that countries need to achieve their goals?
When you look at the global levels of even just COVID vaccination, right, despite the best efforts of the global community, it fell short. Mm-hmm. So I would ask you, were there any bright spots that came out? I mean, I would not want to believe that we went through these horrid couple of years and the world suffered so greatly and there wasn't a takeaway that's been tangible.
Yeah. Well, I would say there's a couple takeaways and there's a big process underway on that. So in terms of takeaways, I think we all felt and understood more deeply than ever the imperative of the health workforce, right? They are the backbone of a healthcare system that keeps us healthy. The health workforce is radically remunerated. They're underpaid around the world, and the vast majority are women. So that has been a bright spot, is that light has been shown on health workforce to try to improve equity, improve pay, improve the safety for health workers everywhere in the world, and really invest in that as a core building block. So that's a bright spot because we're seeing some change and that happening and countries taking that on as a priority. Countries around and here at the UN, they're talking about some of those hard-fought lessons of COVID. Where did the world fall flat on things like vaccine inequity around the world? And they're having some hard conversations about how do we hardwire better solutions on a global scale to ensure that each and every country is better prepared, but as a global community, we're better prepared as well. And there's a high-level meeting on pandemics that's finishing up this afternoon that's really centered on that key question.
Last question. If you could institute one change right now that would improve the state of global health, what would it be?
Invest in it as a human right, which is really what it is. Health is a human right. As you already mentioned, it suffers from underinvestment in national budgets, which is not commensurate with what people experience and live every day. They deserve the right to be healthy. They deserve the right to have healthy kids, to have both freedom from sickness and when it can be avoided and prevented, but also access to care. And if leaders really turn on to that concept, I think we'd see a radical change.
Kate Dodson, thank you so much.
Thank you.